Dr. Sareen, Shri Sapolia, Shri Das, distinguished guests, ladies and gentlemen. Even though it is a hazy day, I am happy to be here today for the third Foundation Day of the Institute for Liver and Biliary Sciences, set up by the Government of Delhi as an autonomous super speciality medical and research institute with the objective of providing a high-class facility for diagnosis and treatment in the field of liver and biliary diseases, including a center for advanced dedicated research. At the outset, I wish everyone a very happy and useful New Year. I also thank the organizers for having invited me today. One of the most important functions of a responsible government in a democracy is to provide healthcare coverage to all, especially the marginalized and deprived sections of society. While provision for universal access to healthcare is in itself a noble objective, there are enormous economic costs to the country which can also be saved by providing preventive and curative healthcare. According to a report of the Working Group on Disease Burden for the 12th Five-Year Plan set up by the Planning Commission, losses because of premature death only due to non-communicative diseases are projected to increase cumulatively, and India stands to lose $237 billion during the decade 2005-2025. India also loses a substantial number of lives during the productive years of its citizens. The WHO estimates that a 2% annual reduction in the national level chronic disease death rates in India would result in an economic gain of $15 billion for the country over the next 10 years. Modeling studies have also shown that per capita income in India would increase by 87%. I repeat, 87%, if only the cardiovascular mortality rate per annum declines by 1%, whereas a 3% annual decline would increase per capita income by 218% by the year 2030. Similarly, communicable diseases are also major causes for morbidity and mortality, leading to lost productivity, missed educational opportunities, and a direct negative impact on growth due to high healthcare costs. The indirect cost due to negative impact on domestic and international tourism and trade can also be significant. My purpose in highlighting these facts and figures is to underscore the importance of access to affordable and quality health care towards the attainment of our larger goal of inclusive socio-economic development in the country. The provision of quality health care has to be a joint effort of the government, the private and the non-profit sector. I believe that towards this objective, the ILBS is a laudable initiative of the Delhi government to provide for a state-of-art facility for patient care, including advanced and dedicated research at affordable costs. The Institute has already implemented liver transplant programs successfully and also recently launched renal transplant programs and dialysis unit for treating patients with comorbidity of liver as well as kidney. These are welcome developments. The ILBS also has a mandate to be a pioneer in the higher medical education and advanced research in related areas. I am informed that in Phase 2, as part of the Institute's expansion program, additional facilities will be created. It is my hope that in the years to come, the Institute shall become a model institution and develop the best clinical protocols and operational systems. Friends, let me conclude by complimenting the entire team at the ILBS for making the vision of establishing a new super specialty medical institute a reality. I hope the institute would usher in a new era in delivering of quality and affordable public health care to all sections of society. I wish the institute every success in the coming years. Jai Hind.